We are really excited to kick off the webinar series with Catherine Davies here from Monticle. Catherine is the managing partner of Monticle, an organisation that facilitates partnerships within the NHS. And previously, Catherine held executive roles in Monitor, which is the health regulator, and with NHS Foundation Trusts. And she brings these insights to Monticle, offering health companies unique sets of perspectives and connections to really help you facilitate that networking into the NHS. Catherine is also now available as a mentor through the EIT Health Mentoring and Coaching Network. So if you want to continue to work with her after this webinar, those are the avenues that will help support you in doing that. I'm going to stop talking and hand over to Catherine. At the end of the session, we're going to have an open format Q&A. Please be aware of the fact that we will be recording these sessions to release them onto YouTube in future months. But I would say that we can have a fairly open exchange, bearing in mind that there are quite a number of people registered on the webinar, but if you need us to remove anything from the recording or what have you, you can just let us know. Please feel quite comfortable amongst your peers here with your startup network. And there'll be a few little moments for interactivity. You continue to use the chat function and the Q&A functions as you see fit. Don't be strangers. And with that, over to Catherine.
Great, thank you so much, Rosemary. Okay, so I'm going to share my screen so we can go through the presentation. So, oh, there we are. So, hello, everyone. It's great to have you here today. So, today we are going to talk about some of the challenges facing health tech companies looking to sell into the NHS, and I'm going to give you some advice on how best to maximise your chances of success. As we go through, I'm going to ask you to respond to a couple of polls. So you should see on your little menu that you have a poll icon that will pop up whenever I get it going. So please do respond to that. I'll also ask you for some views on a couple of things as we go along, and you can put your answers into the chat, please, if that's okay. And then if you have any questions as we go, feel free to put those into the Q&A, and we'll either pick them up as we go along or save them until the end, depending on how it goes. So I'm with you for about the next hour or so, and so feel free to ask me any questions you have about partnering with the NHS along the way. So I'm going to talk about the size of opportunity for health tech companies wanting to sell to the NHS in England, and also give you a bit of a sense of the political and policy context that we're seeing just at the moment. I'm going to outline some of the challenges for health tech companies looking to grow into this space and give you some tips and advice. And I'm going to talk a little bit about the usual routes to market that I see. Those tend to be pilots, partnerships, or procurement exercises to allocate suppliers on contracts. And I can tell you a little bit about which of those is most suited to you, depending on where you're at with your business. I'm also going to give you a few pros and cons about those three different routes to market to help you maximise your chances of success. I'm going to check in with you as we go along, and then, as I say, we're going to have a little Q&A at the end. So just by way of an introduction, I'm Catherine Davies. As Rosemary kindly said, I've worked in the healthcare sector here in England for more than 10 years. As an executive director within the regulator Monitor, overseeing procurement complaints and market studies, looking at a range of different parts of the NHS market. And I also oversaw a large number of NHS mergers. So the good thing about that is that it enabled me to really understand how the NHS works in England, and it is quite a complex system, but also to meet some really great people that I'm still connected to. I now work with health tech companies directly. I'm really passionate about harnessing innovation to help patients and to create an efficient and effective publicly funded healthcare system. So I help clients understand where best to focus their energy so that they can be successful. And I connect them with people in my network that I think are looking for solutions to problems that they have. So I've just started working, for example, with a Spanish company Beatrice is the chief executive there. I'm mentoring her through the EIT mentoring program. Her technology is doing really brilliantly in Spain, and she's thinking of expanding into the UK market. So we're going to do a piece of work together looking at the political and policy context for her technology, and start having some conversations with people whose views will be important to help her decide whether to focus her efforts selling to the UK market. I'll connect her with clinicians, managers within the NHS, and some commercial partners that are all potential customers for her. But first we'll start with some informal conversations so that she can understand a little bit more about where they are and what solutions they're looking for. And then she can decide where to focus. I've got a network of experts across the NHS that I can bring in to help, depending on the particular sector that the particular bit of the sector that my clients are in. So I have experts in primary digital health, mental health, and a number of other areas, and we work together as needed. And there you've got my contact details. If you'd like to get in touch with me, feel free to drop me an email or just send me a connection request on LinkedIn. So I would like to, let's start off with a little poll just to check that you're all awake out there and not interrupting your lunch. So please, can you let me know if you are interested in partnering with the NHS? So I'm going to launch the poll. Hopefully this will work. Let me know if you're interested in partnering with the NHS. Maybe you don't know, maybe you like the idea of it, but you're not sure. Great, okay, so a very large number of you are interested in partnering with the NHS, which is good, you're in the right place, and others aren't sure, and that's also not a bad place to be in. It can be quite a tricky area. Hopefully you can see the poll results there. So a very large proportion of you are interested in partnering with the NHS, so that's really great. So if you could let me know who you are and what you do. I think some of you may have already done this in the chat box. So I'm just going to take a look at the chat box. So we've got a range of different types of technologies here from lots of different member states, which is great, from Ireland to Sweden and Spain there, and someone in North London close to me, that's great. Can you let me know in the chat, please, who you think would benefit most from your technology? So who are the recipients of your technology? Are they people with particular conditions? Are they people trying to stay healthy? Let me know in the chat box, please, who your customer is. So Paul says that he's helping cancer patients. We've got new mums who want to give breastfeeding a go, orthopedic patients, GPs, okay, great, patients in hospitals. Paul's helping people with speech impediments. He's got a speech therapy service, I know that. We have, look at all these fantastic companies. Software platform with AI algorithms, patients who might have an infection, teleradiology companies, great. Mental health users, care staff, fantastic. Gosh, look at all these fantastic companies. And could you have a think about who you think will buy your technology? So do you have a sense yet of who the purchaser of your technology would be? In the NHS specifically. So are your customers likely to be hospitals? Are they likely to be GP practices? Are they likely to be NHS purchasers such as clinical commissioning groups? So if you were to be pushing forward in England, who do you think you would actually be selling to? So Katie saying public system insurance providers, NHS, yeah, GP partners and practices, yeah. Someone, Christian's not sure, hospitals and business managers, NHS trusts, yeah, yeah, CCGs and GP practices and CCGs. Okay, that's really, really great. ICSs, oh, someone's all on board with the lingo of what's happening here at the moment, that's great. Okay, so um, ooh, okay, so I'm just going to go through to the next slide. Here we are. Okay, so I just want to talk briefly about the opportunity and context here. So the NHS is a massive part of the economy. So the budget in the current year is £130 billion, obviously massive. And at the moment, because of the COVID pandemic, there's obviously a huge focus on the NHS. So our Chancellor of the Exchequer, Rishi Sunak, has said that whatever extra resources the NHS needs to cope with COVID, it will get. And the Treasury is making available additional funding to the NHS at the moment. And there's been such a public swell of support for the NHS recently that there's obviously a lot of pressure politically to support the doctors and nurses, managers and allied health professionals, all the people working within the NHS system, and to put as much money into the system as we need in order to keep people safe and well, to treat them when they're sick. And also now increasingly to keep things moving as we potentially face a second wave of COVID. Matt Hancock, he's our Secretary of State for Health. He was always very enthusiastic about technology. That was very much his thing. He really wanted to try and bring the NHS up to date and to use the more modern technology. So for example, he said that he wants the NHS to stop using fax machines, which are still being used in certain parts of the system, and to come off pagers. So the government recently ran a communications procurement to encourage organisations with communication software to apply to be on a framework agreement, so that hospitals could use essentially secure versions of WhatsApp instead of using pagers, which are still being used across the system. In terms of key arm's length bodies within the middle of the sort of regulatory architecture, we have an organisation called NHSX, which is a joint unit bringing together people from the Department of Health as well as from the regulators, NHS England and NHS Improvement. And their remit is to drive the transformation of care. They did a lot to help at the beginning of the pandemic here in England to help people access primary care. They issued guidance that was developed from the Information Commissioner's Office on information governance in order to make it a little bit easier for people to offer GP services to patients and for clinicians to be able to share patient records a bit more easily. I thought that was quite interesting that they decided to do that. The other thing that we're seeing here is that the COVID pandemic has changed the way that the public interact with the NHS. So I thought this statistic was quite interesting. Apparently 99% of GP practices are now offering video consultations, and it was only 3% of GP practices at the start of the year. And I think it's in primary care, and particularly around telephone and video consultations, that we're seeing the greatest transformation. So there's quite a lot of chat about massive digital transformation in the NHS in 2020. Whenever you strip it back and actually look at it, it's really around different ways of accessing primary care services. A lot of people have said that new technologies, new treatments and working practices that might have taken months or years before have been fast-tracked and implemented within a matter of weeks, and it really is quite extraordinary. And I think the pressure around coming up with solutions to try and resolve challenges brought about by the COVID pandemic have really sped up the rate of implementation of technology. So one of the challenges for organisations that are looking to sell into the NHS is that it really is a very complex structure. And even, you know, when you're like me and you spend all day, every day helping people navigate that structure, it's still very complex, even for us. And it changes so much as well. We don't leave the NHS alone for very long. We're constantly trying to restructure it and make it work better, which means that it can be quite difficult to understand exactly how it works. This slide has been prepared by a prominent think tank called the King's Fund, and it just explains how providers in the NHS are regulated and commissioned. So at the top, we have NHS England, which is essentially the purchaser of all services in the system. It gets funding from the Department of Health, and then it decides money should be pushed down into the system. It recently merged with NHS Improvement, which was responsible for overseeing provider activity in the system. And together, NHS England and NHS Improvement are really important stakeholders. And we'll come back to this in a minute, because when you're looking to position yourself, so you're solving problems that the system is worried about, the work that NHS England and NHS Improvement do on policy is very important. Then there's a Care Quality Commission that regulates the quality of services provided. If you want to provide healthcare services to the NHS, you must be registered with the CQC. NHS England and NHS Improvement have a network of regional teams, and those local teams can be very important and influential as well in terms of helping you be successful. So, for example, recently I mentioned that there was a communications framework agreement. There's some central funding available to the suppliers providing services under that framework agreement, and that funding is accessed through these NHS England and NHS Improvement regional teams. So if a trust wants to avail itself of the services of a provider under that framework agreement and it wants funding for it, it needs to submit a funding request that goes through these regional teams, and then the regional teams essentially approve the funding and send it to NHSX, the sort of sponsoring body, and then the funding flows back through that way. So having good relationships with these regional teams can be very important. In terms of the local position, really, the main thing to note here is that what we're really trying to do is move towards a more integrated, less siloed way of working across the NHS everywhere. So a few years ago, we introduced sustainability and transformation partnerships, which were essentially regional groupings of purchasers and providers. They are now becoming integrated care systems, or ICSs. And these are really integrated commissioners and providers of services across the system. So the problem that we're trying to resolve here is that without integration, you have siloed providers. So the work that GPs are doing doesn't necessarily flow through, and information isn't necessarily provided to hospitals when patients are discharged from hospital. Again, information about those patients doesn't necessarily flow back to GP practices unless they're working together in an integrated way. And each bit of the system is sort of focused on what it's doing, and the thinking behind integrated care systems is to try and get people to sit down and look broadly across what's happening in their health economy, to identify particular priorities, and then to work together to try and make the health and care system work well for people in those geographic areas. The purchasers in the system are generally clinical commissioning groups, as well as local authorities who now commission some services that used to be commissioned by the NHS, for example, sexual health services. And although commissioning is sort of, I would say, moving into these integrated models with integrated care systems, thinking about how to commission services in their areas, until we have a legal change, a change in the legal framework, clinical commissioning groups are still the legal entities that hold contracts with providers in the system. So we seem to be moving away from clinical commissioning groups having a very important role in the system, but nonetheless, they still have a role to play because they are the holders of contracts in the system. In relation to primary care, it's important to note that we're trying to get GP practices to work in a more joined up way with each other. That's partly to make sure that people have access to primary care and they don't have to go to A&E just because they can't see a family doctor. But we also want to make sure that the sort of the working life for GPs is manageable. And so one way of doing that is to encourage GPs in the local area to come together and collaborate with each other so that they can refer patients into each other's practices as needed. And then it means that they can manage their working lives a bit more effectively. So a second challenge is that there are many, many NHS organisations out there. It's really best to think of the NHS as a brand rather than an organisation. As I said, the system is constantly in a state of flux and change. The number of clinical commissioning groups out there is changing because they keep merging with each other. But there are around 135 clinical commissioning groups. We have around 220 NHS trusts and around 6,000 GP practices. Now, often people come to me and they say, well, we've worked with one trust and we've perhaps run a pilot with that trust. We've been able to establish our value proposition. We're able to help using our technology. So how do we scale up and roll out our technology across the whole of the NHS? And the situation at the moment, there are various initiatives out there to help, but really what companies are having to do is to sell their product to each and every single organisation that they want to contract with. Which does make life quite difficult. Often people say the first one or two are very hard. Then going from 1 or 2 to 5 or 6 is also very hard. And once you get past 6, it does tend to be a little bit easier. But the message is that it is quite difficult, but it is worth doing. There's a fantastic opportunity here for companies, but it can be quite slow and can be quite complex. So it can take around 6 months to get projects up and running if you're fast and everyone wants to do it quickly and get it to work. And about 12 months, I would say, would be normal. So one of the things we're seeing at the moment is that some health tech companies just run out of road. They run out of money before they really have a chance to get their tech up and running and to scale it up. And so in the work that I do, I try to help companies to do that more quickly. So if you are active over outside the UK, so I know that we have companies in Spain and France and Sweden and Ireland on the call today. So if you're thinking that you are up and running in another EU member state and you'd like to work with the NHS, I think there are 3 main routes to market for you: pilots, partnerships, and as a service provider following a procurement exercise. So I'm just going to talk a little bit about these. So pilots are generally a centrally funded early stage sort of experiment. It's a good place to start. And an example would be primary care video consultation. So pre-COVID, a lot of GP practices were starting to think about ways to help people access GP appointments more easily. And they ran pilots for video consultations, which has now served them very well. And these areas have found it more easy to scale up during the pandemic. So Southwest London ran a pilot for online consultations for primary care. Now, I will send around these slides, or Rosemary Alla will send around these slides afterwards, because I put some links in here, and if you want, you can follow the links to actually go and find out a little bit more detail about some of these projects I'm referring to here. So pilots generally last around 6 to 18 months. I would say that a pilot that runs for 12 months is sort of a good time. 6 months tends not to be long enough, and 18 months can sometimes be a little bit too long. A pilot tends to be done in partnership with an NHS provider. And sometimes they can be advertised as a contract opportunity. And I've got an example of that here. Or sometimes a pilot can be shared with a network. So it is good to be networked into organisations in a particular part of England, because then you get to hear about these opportunities. Some pilots are done for free. I prefer it if health tech companies can avoid doing free pilots, because it can often be quite a lot of investment of money and effort without any guarantee of work further down the line. And I think that paid pilots are better if you can negotiate those. If possible, go down that route. There's an example recently of an innovative health tech company that provided a lot of its technology to NHS trusts for free during the pandemic, and now it's has a funded offer, and it's finding it quite difficult to get funding out of the system for that. So be aware of that. If you're thinking of doing a pilot and you think I'll do it for free, people will see my technology is great and then pay a lot to have the technology continue. It doesn't always work out that way, so just watch out for that. Other things to watch out for would be making sure that the purpose of the pilot is clear, and the way of measuring success of the pilot is also clearly articulated at the outset. So some companies I've spoken to who have done pilots said they had an idea for something they were trying to demonstrate, but it turns out it was a bit different to what the NHS organisation they were partnering with were trying to do. So just be careful. It's such an obvious thing to do, but just really do take time to set out your goals and figure out whether how you're going to work out if it's been successful before you start. Also have a think about what will happen after the pilot. So again, another example, another company I was working with, after the pilot, nothing happened, right? But sometimes people move jobs, and the individuals concerned can move on. So they invested a lot of time and money in a pilot, and after it was finished, that was it. So you don't really want that happening. So think about that too. Another thing would be to allow extra time if you're relying on other NHS organisations doing something. Apologies for that typo. Or if you need to integrate your tech with another organisation. So thinking about this pilot on video consultations. So a clinical commissioning group was paying for the pilot. GP practices were going to be trialing video consultations, so they needed to be bought into the idea. And then patients were going to be using video consultations, so they needed to buy in as well. So those were quite different stakeholders. You had clinical staff within the GP practices, needed to set it all up and get it up and running, working with the video consultation provider. And you also needed to tell patients that it was available and make sure it was working well for them. So that's just something to bear in mind, because it's, again, takes quite a bit of work and a little bit of time, the more organisations that you need to involve. I'm just going to have a quick look at the Q&A here. Oh, so Christiane is asking about Brexit. I'll just deal with these questions briefly while we can, because they're fairly straightforward. I mean, we still need technology from companies outside the UK. And at the moment, we're waiting for clarification on exactly how companies from other EU member states operate in the UK. We know that they'll need to have they'll need to be established in the UK. They'll need to have business operations in the UK. And at the moment, we're having a look at what happens with CE markings and whether they're transferable for devices and so on. So Brexit creates uncertainty, but we certainly don't want to give the impression that we don't need technology from other EU member state companies, because we definitely do. Katie's asking if pilots aren't recommended. No, I think pilots are a good idea. I would just say that you need to make sure that they're set up properly, and ideally that that they're funded as well, and that you have a look and see how other pilots have gone. There's a lot of publicly available information out there, so just make sure that you set them up right. Damien's asked if a pilot is supposed to be cheaper than your real price. That's certainly one strategy. So it can sometimes make sense to have a cheaper price, so that the commissioner of the pilot can see the value, and then once you've demonstrated the value, so for instance, if your technology saves money because something else in the system doesn't need to happen as a result of your technology, then you can then share in the gain that comes from using the technology. So you could start off with a lower price until you establish value, and then renegotiate the price. But if that's what you want to do, I'd recommend having that conversation up front rather than as you go along. So the next route to market I want to mention would be partnerships. So let's say you've done a few pilots. So you've carried out a small number of pilots and you've established a proof of concept. Partnerships then would be the next step for you. So they generally tend to be larger projects that are normally co-designed and co-delivered with the NHS. An example would be the Testbed programme, which is a government-funded programme to help established health tech companies scale up. Funding is normally made available from the Office of Life Sciences, or from another bit of central government, the Department of Health, for example. And there's quite significant funding available for these projects, so somewhere between 500,000 and up to and over £1 million. So there have been 2 waves of testbed programs, and some of those programs received really significant funding, as I say, of around £1 million for wave 2 of the test beds. They generally tend to last around 12 to 18 months. And an example would be, for example, the East Midlands Radiology Consortium. We're doing a piece of work on breast cancer screening to try and optimize breast cancer screening. And they've joined forces with a tech company called Chiron Medical that use artificial intelligence to help radiology for breast cancer in a number of different ways. They were doing something really interesting recently as a result of COVID, in that they were helping radiologists triage patients who hadn't come in for breast cancer screening as a result of COVID, so that they could identify the women most at risk of breast cancer, so that their screening could be prioritized and brought to the front of the queue, rather than just going through a long waiting list in chronological order. So they were using the AI technology to do some really interesting triage and work alongside the radiologists and the trusts that were running the screening programs. So that's an example. Both of those bits of the system were already sort of up and running, and then they came together into a partnership. If you're doing a partnership, obviously, again, you need to think about the key stakeholders and what you need people to do. So, for instance, another example of a partnership was in Salford, where they used artificial intelligence to help triage patients coming into A&E. And they were using the technology alongside the A&E clinicians. So there they needed to get buy-in from the clinicians, from the managers, from the IT department, the health tech company, as well as the A&E staff. And then they wanted to be able to talk about that more broadly in their region. So there were other stakeholders that they needed to interact with. So again, often there are quite a lot of people involved with these projects. When you're doing a partnership, obviously you need to think about what's in scope and what's out of scope, and what would have happened otherwise. So if you're trying to use a partnership to demonstrate that technology works, that it's effective, that it adds value, then it's important to think about the situation that would have happened without the technology. So are you able to measure what's happening today before you actually start your partnership, and use that as a benchmark? Thinking about the evaluation approach, again, it's very similar to the issue with pilots, where you're thinking about how you're going to measure success. So what will the approach to evaluation be, and who's going to do that? And also think about the data that will be needed as you go along, and make sure that it's properly tracked. So the third route to market is what I've described here as a service provider arrangement. And this is a situation where a company bids to provide services to the NHS in a public procurement exercise. So this is generally for established companies with a track record of working with the NHS already. A company will respond to a procurement exercise, for instance, a framework agreement. There are quite a lot of frameworks at the moment, and it's useful if you can to get yourself onto a framework agreement. There are a range of different ones out there. Some of them open fairly regularly, and therefore all entities providing services to government bodies, and some of them are just NHS specific. But they essentially provide a contracting mechanism for NHS organisations. So it means that if you're having a negotiation with a hospital trust, for example, and you can say we're on this framework agreement, it makes it easier for that hospital to buy your services, and you can normally contract a bit more quickly. Some framework agreements have central funding. So the communications framework agreement that I mentioned before has £3 million worth of funding available for the first 12 months of the contract. And the idea is to incentivize trusts to, that one was about moving away from pagers and use more modern and secure messaging technology. And I mentioned before that the local NHS England team needs to submit a funding request to the body that's holding the funding for that. The interesting thing about this, and this is something to watch out for, is that this initiative is central. So sometimes the framework agreement initiatives come from government, they come from the Department of Health, because it's decided that something needs to change in the NHS. But you still need those local relationships, and you still need a local need. So for instance, just because the Secretary of State thinks that a trust shouldn't be stopping using pagers and using different types of technology doesn't necessarily mean for a hospital that that's its top priority. So being on the framework, it's not a guarantee of work in itself. You still need to put in the legwork and understand what's happening in local areas, what their problems are, and figure out how best to help them. So again, you need to make sure that local organisations know about these framework agreements. So I was talking to a trust recently about the communications framework agreement and the funding associated, and it just hadn't heard of it because it was off, you know, doing the day job, healing the sick and looking after people, and it wasn't keeping an eye out for these centrally managed procurement frameworks. The other thing is, you know, if you have a local body that has to submit a funding request, is it a priority for them? You know, what's going on with them? So really the message here is that framework agreements can be a really effective way into the market, but they're not a substitute for doing a lot of legwork and having lots of conversations with local NHS bodies. So I've been talking rather a lot. So which type of approach do you think would work best for your company and why? Could I ask you perhaps to pop some comments into the chat box? So do you think that a pilot would work for you or a partnership or a procurement service provider type arrangement? Christiane says, yeah, definitely a pilot. Yeah, I think if you're at an early stage and you haven't really done anything yet, then pilots are a really good way forward. Yeah, so a number of you are saying pilots, that's great. Yeah, and Paul, you're saying a pilot. So Pat saying that your product requires a consultative approach to define the project and requirements. Absolutely. I mean, that's a really good idea. By all means, start a dialogue start a dialogue, see what's happening, and then decide on the best approach. And the NHS, there are lots of pilots. Someone says it has more pilots than British Airways. So people are very familiar with the concept of pilots. So if you have a conversation, there seems to be interest, you suggest doing a pilot, then people know what that means. Still, the detail has to be worked through, but that's, if you said you were interested in doing a pilot, people would understand what you wanted. And as I say, yes, try and negotiate a paid pilot if at all possible. Michael's looking at a partnership. Partnerships can be really good. They can be very effective for scaling up, definitely. Okay, so what I would encourage you to think through whenever you're thinking about the NHS, and you know, I'm sure that this really applies to any healthcare system wherever you are, and I'm sure that you do this already, but the reason I mention it is often when I talk to health tech companies, they're super enthusiastic about their product and their technology. Often they'll have seen a problem somewhere, they might have experienced a problem, or someone they know has experienced a problem, and so they've come up with a solution to that problem. But sometimes they haven't really understood what the problems are in the market that they're actually trying to sell into. So you can have absolutely fantastic technology, but if you don't understand what the local priorities are in the area that you're trying to sell into, it's very difficult to get traction. And similarly, sometimes people really underestimate, you know, how rudimentary the NHS's current tech systems actually are. So a lot of companies say that they send demos over to NHS organisations for them to take a look at. They can't even see the demos because they're on such outdated versions of Windows that they're not even able to watch the demo. So do bear that in mind. I encourage you to think through what problem you're solving and also how this helps the NHS as a system. So this is something that the NHS thinks about a lot. So for example, if you are offering a service that helps people stay well, you might be asking GPs to do a little bit more work in terms of population health management or prevention, but then you might be keeping people out of hospital with the cost associated with that. So thinking, that system thinking can be very important. Now, sometimes the issue with that example would be you're asking the GPs to do something that will help a hospital. That's not where the GPs are. So someone somewhere has to do more work that benefits another bit of the system. And sometimes that can be quite a hard sell. And if that's what you're doing, then you can look to see examples of where perhaps GPs and hospitals have come together. So some hospitals now actually have integrated GP practices within them. So if you had that sort of technology that was about the GPs doing a bit more on prevention in order to keep people out of hospital, I'd be wanting to have conversations with hospitals that had integrated GP practices. So when you've articulated the problem that you're solving and how it helps the NHS as a system, you really need to ask yourself, is the NHS worried about this problem as well? And if the answer is no, it's just going to be really, really hard. And I'll tell you how you can figure out if the NHS is worried about the problem in just a minute. I'll work through an example. So think about who the user is, think about who the purchaser is, and think about how you can reach that purchaser. How can you start having conversations with people locally? It's really in those conversations that opportunities come about. You might, for example, if you have technology that you want to sell to a hospital trust, you might be emailing your director of innovation or your chief technology officer or your digital director. They've got slightly different job titles in different organizations. But you want to be looking out for those sorts of people and then sending them an email just saying, look, we see that X, Y, and Z is happening in your area, or that you're worried about this. We have some technology that can help with it. It's already up and running in Sweden, France, Spain, Ireland, wherever it happens to be. Can we have a conversation about it? And generally, people are pretty good. They will get back to you and say, yeah, sure, let's have a quick call. You can have an initial conversation and then take it from there. And that really is the way into the system. It's doing that quite a lot. I definitely advise people not to cold email, just send out hundreds of emails. If you buy an email list from a provider, there are various publishers that have NHS email lists. The return rate on cold emails isn't very good. So I don't normally advise that. And I'll come back to that a bit later. So, okay, we just have a couple of questions. Let's see. So Andrew's saying co-design seems to be taboo between the NHS, universities and SMEs. I don't know about that. I think it's a little bit variable. I think it depends what the service is, perhaps. So I don't know. I think that's a little bit mixed. Tice has a question. Do you have to have a pilot before moving on to a partnership? No, you don't have to do it that way. It's sometimes a kind of logical way to proceed. Can you use what's POC? Sorry, I'm not sure what that is, but if it's proof of concept, can that come from another study elsewhere? Absolutely. Often the NHS is very risk averse, so it doesn't really like being the first person to do something. So if you've done it somewhere in the NHS, it's generally an easier sell the next time you do it. But if you have something up and running in another country or even another sector of the economy, so one of the things I'm seeing at the moment is that there are quite a lot of companies that are moving into the healthcare space because of everything that's been happening this year, and they don't have much experience in health, but they do have experience elsewhere. And that could be quite influential. Gordon's asking, can we use AHSNs to help us pilot our services? Yes, definitely contact AHSNs to have a chat with them. Again, some are more helpful than others, and some have structured programs that they want you to join, whereas others will be happy to just to have a chat with you. A lot of them run surgeries. They generally have a director of commercial partnerships that you can email. Our email addresses are normally on the AHSN website. You can have a conversation with those people, and generally they'll give you some feedback and connect you with local NHS organisations where that would be helpful. Okay, so I just want to work through this example of I've just taken mental health in London as an example. I really could have chosen any example at all, but I just wanted to talk you through what I would do if I had let's say I had an app that helped people manage their mental health, and I was based in London for the sake of argument. So what I'm kind of thinking here is, in order to really use my time and energy in the best possible way, how can I be smart about where I focus my efforts? So I know about my technology, but really what I need to do is a little bit of due diligence to understand what the issues are around mental health in the City of London. So I want to work out where my tech fits, who it helps, and who will pay for it. So if we think about the structure I mentioned before, you've kind of got national context, local context, and then who the customers are likely to be. So that's quite a good structure to work through. So in terms of the national policy context, so there are a couple of really key strategy documents if you want to work with the NHS. A few years ago, we had something called the 5-year forward view, which was published by NHS England, and it set out a vision for the NHS for 5 years ahead. There was one on mental health as well, 5-year forward view on mental health, and that set out key priorities for mental health nationally. Then the next sort of strategy document was a long-term plan that was published a couple of years ago, and it was essentially supposed to be a 10-year strategy document for the NHS. Obviously, that's changed a little bit as a result of the pandemic, but it hasn't changed that much. It's actually some of the strategy ambitions that were in the long-term plan have been accelerated as a result of COVID. And a lot of the basics are still really there and very relevant. So again, if I had a mental health app, I'd be looking at the 5-year forward view of mental health to see what the priorities were, and also having a look at the long-term plan. And there's a particular section in the long-term plan about mental health and investment in mental health, and actually identifying mental health as an area where the government wants to invest more money. Because there's been an ongoing debate for several years about the fact that we've been prioritising physical health over mental health. So to get a sense of national priorities in the national policy context, I'll be looking at the long-term plan. Then if I'm thinking about London, I'd want to be looking at London's strategic vision for healthcare as well. So there's something called Health and Care Vision for London. All these links are in the slide, so you can take a look. And Health and Care Vision isn't specific to mental health, it's generally what healthcare system leaders across healthcare, local authorities, and the Mayor of London's office want to be focusing on. So they have 10 specific priority issues that they're focusing on, and one of them is improving mental health and progress towards zero suicides. So that's what they're focused on. So if your technology isn't in one of the 10 specific priority areas that's in this Health and Care Vision for London, you have to have a think about whether London is the right area for you, for your technology to be spending your time and energy. And it may still be that you can help. It may be that your technology isn't specifically identified as a priority, but there are other reasons why you think it's helpful. But there might be other areas of the country that are focusing on your particular on the problem that your technology resolves. But I think the key point here is it really is worth trying to understand what local health systems are trying to do, because it goes without saying, if you're offering a solution to a problem that people are already worrying about, you're more likely to be pushing at an open door. Then just on the mental health example again, NHS England and Improvement have a mental health clinical network that's available on their website, and there's quite a lot around the work of the clinical network, what their priorities are, what they're trying to do. So again, the more hooks that you can find within the kind of policy and political context, the easier it's going to be for you to open up a conversation with a contact in the NHS. In terms of who the purchasers might be for a solution, there are a range of purchasers in London. So in London, we have these 5 sustainability and transformation partnerships that are, as I say, these are the kind of regional groupings of providers and purchasers that are now moving in the next few years to become integrated care systems. So again, we've got East, North, Northwest, Southeast and Southwest. And again, each of those STPs have information available on a website about the things that they're focusing on. So I go and have a look at what they're saying. So an example would be Northwest London Integrated Care System has got, it's big, these are large groups. And in theory, it should be, if you can get traction with an ICS, it should be easier for you to scale up, because if you see this Northwest London one, it has 10 provider trusts, 8 boroughs, 8 CCGs, and 49 primary care networks. If you can get traction within that ICS, you should be able to, in theory, roll out your technology across the NHS more easily than you would if you had to have separate conversations with all of those individual organisations to sell the concept of your technology. Clinical commissioning groups obviously are are often are purchasers of tech. Again, for the mental health example, I would then have a look to see, okay, so who are the CCGs in the bit of London that I'm focusing on? Say it's East London. I'd go and have a look at those CCGs and again, see what their priorities are and see if you can position yourself as a solution to their particular problems. And obviously, a lot of tech companies sell to providers directly, but again, they're all super busy. Everyone's really busy all the time. They're kind of firefighting. With COVID, it's even more difficult for people. So to be able to get people's attention, you really need to be providing a solution that is a solution to something that they're really, really worrying about. Let me just have a look at this question. Andrew's asking, is there any way I can find out where a hospital is developing a paediatric outreach program with community engaging parents of newborns? You can, yes, I mean, I think have a look. I mean, I would choose an area, just choose an area, choose a hospital, and then see if you can make a connection with someone in that hospital and just have a, like the pediatric team, and see if you can have a conversation with them. Or it may be that if you're trying to avoid attendance at A&E or GPs, that you can find a GP network to have a conversation with about whether they'd be interested in helping you understand. Definitely the first step is to understand what's happening today and where the issues are, and then see whether you can have a conversation about solving some of those problems. Where can you look? I would look at hospital websites, look at their strategy documents, their annual reports. You can put a request out on Twitter, put a request out on LinkedIn to see whether people in social media can connect you with the right people. Okay, so the next question is, for a mental health app based out of London, what are the prerequisites to start these conversations? CE approval, initial level, yeah. You'll need to have taken some legal advice about the regulatory requirements to make sure that you have the registrations that are needed. That's not something that I do, but I have people who can help with that. So if that's something, if you'd like to be connected to lawyers who can provide advice on that, I'm happy to do that. Just get in touch later. In terms of what you need, yes, I mean, you need some initial evidence, I think, to be able to get the NHS to give it a go. The NHS is, as I say, it is quite risk averse. And there is a slightly circular problem where, you need to have traction in order to be able to demonstrate value, but to demonstrate value, you need to have traction. So it can be a bit tricky. But again, there are some really interesting organizations out there doing really good things for mental health. I have a really good trust in Surrey that's doing really fantastic things on tech for mental health. So I can connect you with someone there if you want to get in touch with me, and you can have some initial conversations, and then often those conversations lead to more contacts. You can see where that goes. But on the regulatory side, yeah, probably you need to get a little bit of legal advice on that. Okay, so I just wanted to finish by talking about what problems people come to me with, and what I suggest they do. Often people will come and say, this seems like a massive opportunity. It also seems really complicated. I literally don't know where to start. I just don't know what to do. So I would just suggest doing some research, a little bit like the example, the mental health example I've taken you through. Just do some research and make a plan and start having conversations, start having connections. The NHS it's really worth trying to partner with the NHS, to work with the NHS, but it's not quick. If you want to do something quickly and earn lots of money over a short period of time, then this probably isn't the sector to be focusing on. But otherwise, if you're patient and it matters to you, and if you've worked with the NHS, it can really help with the value of your own brand. So we see organisations that work with the NHS and then they export their technology to all sorts of other markets. So it's definitely worth persevering, but do your research and make a plan. And then people say they don't know who to talk to. There are too many people. And so there I would say, go deep rather than wide. So a mistake that a lot of tech companies make is they try and talk to too many people and they end up not really talking to anybody. So you do need to really do your research, do the legwork, try and understand your customer as best you can through doing that research. Then you'll identify a number of people to talk to, and then just start having those conversations. Generally, people are very approachable and happy to chat. They do sometimes ignore you. So sometimes people will be like, we sent out all these emails and nothing's happened. People are just ignoring us. This is terrible. But then I would say that's normal. People are busy. Don't give up. As business owners, I'm sure you're all persistent and resilient, and just dig into those reserves and keep going. Sometimes people feel that NHS contacts don't want to listen to them. And I do think that this does sometimes happen if you start by talking about your technology rather than talking about them. So I spoke to an innovation director recently at a very innovative trust in the Midlands in England, and he said that he gets approaches from health tech companies. It's just a standard approach that he knows they're sending to everybody. So they haven't really tried to tailor it. And I know it can be difficult, it can be a bit of a pain, but whenever he gets an approach, he thinks like, why do you want to work with me? Like, what is it about my trust that you're interested in? Is it because we have a GP practice that we've integrated? Is it because we already work with health tech companies, so you know we're interested in innovation? Is it because of the demographic of the patients that we serve? What is it about my organization that makes me attractive to you? And if you can start there and work from there, then obviously you often get a bit more traction. This demo one I mentioned before, sometimes people, they've spent a bit of time putting together a really great demo, but then they don't get any feedback from the NHS. Sometimes it literally is the NHS contacts just can't access it because their IT is so old. Then another one is, okay, so you've sent your email, you've had a conversation, and then you're having a meeting with a potential customer in the NHS. So who do you need to impress the most? And one of the funny things about doing business with the NHS is it's actually very democratic. So I think sometimes in the private sector, if the chief exec says, this is happening, then everyone says, okay, fine, this is happening, this is the plan. But within the NHS, it's a little bit more nuanced than that. So you will often find yourself in a situation where you'll be canvassing views from everyone around the table. And, you kind of reach a group decision about whether to proceed or not. And that can sometimes be quite difficult for tech companies to get their head around. So you have to appeal to lots of different people in the way you talk about your solution. So if you're talking to the chief information officer or an ops director, you're probably going to want to be talking about the ease of implementation because that's what they're worried about. If you've got clinicians, then you're probably going to be talking about how the service will benefit patients. And if there's a finance director there, then obviously they're going to be interested in how much it's going to cost. So you need to impress everybody the most, and the way you position yourself really depends on who's coming along to the meeting and really trying to understand what they're worried about. And again, these informal conversations that you have at the beginning before you get into a sales conversation can really help you understand how that works. And then on the scaling up front, everyone says they want to scale up, but they don't know how. I mean, that is the holy grail, being able to sell your technology to the whole of the NHS. That would be amazing, but it is really difficult. So there's no shortcut to that. It really is just a question of plugging away, establishing good relationships with people and doing good work. So let's do another quick poll. So do you have a clearer idea of where you want to focus to develop partnerships with the NHS? So respond to our poll. Do you feel a bit more confident about where to focus your energy and effort? Oh, I'm glad. That's making me happy to see to see people have more of an idea. Some people still aren't sure, which is absolutely fine. And I would definitely recommend doing the thinking and the prep before you really decide to invest a lot of money, your life savings, to sell your house in order to try and make this work. Because at the beginning, you often have the least amount of information about the market. So it's definitely worth doing as much research as you can. Okay. So yes, most of you have a clear idea, the vast majority of you have a clear idea of where to focus your efforts to develop partnerships with the NHS, which is great. So as I said, if you want to get in touch with me, do feel free to send me an email or connect with me on LinkedIn. So if you've got any questions that I haven't answered, then by all means ask those now. Otherwise, I'll stop there.
Now, Thank you, everybody. We always know that we're onto a winner when we have the same number of delegates at a webinar at the end as what we started with. So thank you, everybody, for your attention and your brilliant questions during that. Catherine, that was absolutely wonderful way to start things with a bang. We will be sharing this and all of the webinars in the toolbox. In the coming months, we'll make sure that those of you who are actually here get those slides. Thank you, Catherine, to, first of all, your wonderful webinar, but also your very generous offer to connect with the startups here. Please do remember, though, that Catherine is also available as a mentor in the Mentor and Coaching Network, should you wish to avail of that formal program with us. I'm just going to pop into the chat the link to register for the rest of the webinars, and hopefully we'll see lots of you again throughout the series. Have a good rest of your Tuesday. Take care.